As advised by the U.S. Food and Drug Administration, South Africa's health department held consultations with the researchers leading the Sisonke trials, the Ministerial Advisory Committee, as well as the South African Medical Research Council, and this is the outcome.
Based on their advice, we have determined to voluntarily suspend our rollout until the causal relationship between the development of clots and the Johnson & Johnson vaccine is sufficiently interrogated. SAPRA will collate information from Johnson & Johnson, the FDA, and other regulatory bodies to make a thorough assessment of the situation and advise us as a regulatory body that has exercised its authoritative powers on the approval of the vaccine in their own right.
Nearly 300,000 health workers have been inoculated with the Johnson & Johnson vaccine in South Africa under the Sisonke protocol without recorded major adverse effects. The health minister was asked if this suspension was not a knee-jerk reaction given the low risk-benefit ratio of the vaccine, even in the US scenario where only 6 people out of 6.8 million exhibited blood clotting.
We think that it's a precautionary halting, so it's not we're closing down on the Johnson & Johnson. As soon as the information is made available, we're quite certain that we should be able to move on.
The minister hopes that phase 2 of the vaccine rollout plan in the country, expected to begin mid-next month, will not be veered way off course with this development, especially as the country has secured 10 million additional doses of the Pfizer vaccine, bringing the total to 30 million. The Medical Research Council is also studying relevant data on the Johnson & Johnson vaccine to see if the process could resume as soon as next week. Also, as people are expected to register en masse next month, a risk awareness consent element will be added to the online registration platform. From Johannesburg, South Africa, Betty Dibia, Channels Television News.
In the meantime, some residents seem confused as to why South Africa is suspending its use of the Johnson & Johnson jab. For someone like Johan van Rensburg, a local resident in Johannesburg, he says Health Minister should have given reasons for the stoppage.
He's left us all wondering. He could have furnished us with some reasons and told us why, given us some scientific research behind his decision. So until now, all of us are left wondering.
I don't think it's a good idea because we need it. We need to be vaccinated so we can survive.
Well, I think it's a little bit premature given the fact that we have had no local reports in terms of the blood clot. But however, you can understand the minister's decision given the fact that FDA is one of the leading in terms of the health organization in the world, and you know what happens in the US tends to influence what happens in the rest of the world.
It's a good thing, I'll say, because it can save lives.
Well, staying with the suspension of the vaccine made by Johnson & Johnson, Dr. Mercy Adionwe is an internal medicine hospitalist, Texas Hospital in the U.S. She joins us for more on the situation. Thank you for joining us on the program.
Well, thank you for having me. Happy to be here.
Okay. So the U.S. first, they started with pausing the rollout of Johnson & Johnson following those reports of blood clots. What's been the reaction in the United States since then?
Well, the reaction has not been a good one. There is already an increased vaccine hesitancy, meaning there is a high rate of people who don't want to take the vaccine due to concerns. So this new report has just increased more people to kind of be on defense of receiving the vaccines.
So as a health worker, does this affect the government's vaccination plans of 3 million a day?
I don't think so. What the White House has said is that this does not delay their vaccination goals because they have enough Pfizer and Moderna in storage for them to be able to administer the vaccinations to the Americans. So yes, no, it does not affect it. But it is a little bit of a bump on the road that hopefully we can overcome once likely they are able to resume it.
What as well does this remind you of? Also, you know, a similar thing that occurred with the AstraZeneca vaccine. I mean, for this one now, we understand that all 6 cases were among women between the ages of 18 and 48, and the symptoms occurred 6 to 13 days after vaccination. Quite a lot of similarities, yes?
Yes, it is. And it's because they're the same type of vaccine. You're dealing with adenovirus vector vaccines. And we are seeing that in these type of vaccines that there is an increased chance of blood clots. Now, the mechanism of why they're having these blood clots is not known for now. There are some speculations, but we have to make sure we recall or remember what the overall picture is. Like here in the US, like you said, there are 6 cases, but there's been about 7 million vaccines that have been administered so far. So if you look at it and you calculate it from a ratio standpoint, that is literally 1 out of 1 million people who have gotten this reaction. So it's very rare. But out of the abundance of caution, the FDA and the CDC have said, let's hold off for a while we can look more into these cases and then maybe devise guidelines and make sure that the healthcare workers are aware of this rare adverse effect to the vaccine.
So looking at the overall picture coming from the US, the cases being recorded, what would you say is the age group sustaining the resurgence of the pandemic in the United States?
Well, that's a wonderful question. So as a healthcare worker that treats COVID patients in the hospital, what I've noticed is now we're seeing a surge of people in their 30s till up to 50s. And it makes a lot of sense because the vaccine, when they first came, when they first started rolling them out to the Americans, the first group were the older population, so the 70s and older. And so I do recall prior to vaccinations, you would see a lot of 70s, 80s, even 90-year-olds coming in and being hospitalized in the hospital. But now that they've gotten their vaccinations, or a majority of them have gotten their vaccinations, those that are coming in are the ones that haven't yet gotten their vaccination. So we're seeing not as many as far as number of people in these age groups, which is the 30s to 50s, getting their vaccination. And hence, they're the ones that have caused the upsurge in states just like Michigan that we're seeing.
So finally, just before we let you go, we understand that in the EU, Denmark has ceased giving the Oxford AstraZeneca vaccine totally. So no one there will be getting it. Do you think that's a wise decision?
Can you say that one more time? I'm sorry. It came out.
So the question I asked was that Denmark has fully said it won't be rolling out the Oxford AstraZeneca vaccine totally. So no one there will be getting the AZ vaccine. Do you think that that's a wise decision, given the breakdown you've given about more of the benefits of the vaccine so far to fighting the pandemic?
Yeah. I mean, I understand that they want to be cautious in regards to vaccinations and the adverse effects of them. But just as I said earlier, as you pointed out, we do have to really realize what is the benefits of the vaccinations and what versus what is a risk. And as we're understanding, yes, although there is a risk of blood clots, particularly in the younger population, this risk is very minimal compared to the number of people who get it. So you're seeing, in some cases, they're seeing 1 out of 100,000. I believe Germany reported that. But here in the US, so far, it's been 1 out of 1 million. But you have to now understand what is the benefits. And the benefits, as you had pointed out, is to reduce your incidence of having a very severe form of COVID-19. And part of that severe form of COVID-19 is you do develop blood clots. So I would, for countries like that who have totally dismissed getting the AstraZeneca, perhaps they have additional data that I'm not aware of, but I would highly, probably recommend just to kind of weigh in the benefits and risks. And so far, what we're saying as healthcare professionals is there's a lot more benefits to receiving the vaccination than there are risks.
All right, we'd like to appreciate your time. Thank you so much, Dr. Messier Dionwe, internal medicine hospitalist, Texas Hospital in the U.S. Thank you for joining us on the program.
Thank you.
We have more on the COVID-19 update. We take a look at the socio-economic impact of the pandemic in Nigeria. Stay with us.